Dear friends, first of all, I'm happy to welcome everybody who may already joined us. First of all, I want to introduce tonight with us, we have a very special guest. She was our guest in our Russian programs for many, many times. But the most important, there are very few doctors, almost none, that can help in the situations when doctor says there's no way to help. And I was personally a witness in my community. I just wanted to say a few words. I don't know if you have people who, I think everybody knows me as well. I don't know if you have people who don't know me. I'm Rabbi Laskin. I'm the director of Outreach Organization, Jewish Soul, Kabbalah teacher, life coach, and work with the outreach with the Russian-speaking Jewish community in the United States, also director of the International Russian Jewish Sabbaton. And I want to tell you, I know many doctors, I know many people that have so much good intention to help people, and I appreciate it. When me as a rabbi, I need to recommend anybody, it's a big responsibility, first of all. And in my community, I was witnessed when people who couldn't have children for many, many years, who tried IVFs, 3 IVFs, and nothing would help. I saw parents with children with development delay, this tonight's topic that we're going to discuss, that when so many different doctors and fly to different countries and nothing really make a progress. And by Dr. Yuabova, I saw how these people with the children had, after a few months, tremendous progress. We saw people who for many, many years had had children. And after 6 months with Dr. Yuabova, they had children. I think, me as a rabbi, one of the biggest commandment that God gave us, the biggest commandment that God gave us is to save lives. But not only to save lives, to transform lives. And to have the maximum of potential in our lives. How can we have it without a maximum health? And this is what Dr. Yuabova is doing. Dr. Yuabova is a renowned doctor of functional medicine. Maybe she will explain today a little bit more. We'll discuss what does it mean, functional medicine, holistic medicine, a holistic approach that looks at the whole person as a one unit. She's based in Florida, but from all over the country, people come. People actually don't need to come. People contact her through telemedicine to have a transformative experience. Dr. Yuabova, she's a best-selling author of 3 books that are actually possible to purchase them on Amazon as well. Dr. Yuabova maybe will also share about this. And Dr. Yuabova is a professor. Doctor, you've been a professor in NYU?
City University of New York.
Correct. But the most important, that I know some doctors that have titles, but I don't know many doctors that have results. And me as a rabbi of a community that I'm committed for my community, for my people to help maximum. And I want to tell you, today's topic is going to be mainly about children, autistic, on the spectrum, ADHD, any development delays, doctor will say, but in general, doctor help. I have people in my community with after COVID, where they could help them with Lyme diseases, with so many different types that in cases when doctor says it's impossible to help, Dr. Yuabova were able to help. And I'm very grateful for Dr. Yuabova for tonight's class, because we had with Dr. Yuabova our Zoom like 2 weeks ago in Russian, and many people asked, we want to have it in English. And Dr. right away says, let's make a date. And I'm extremely grateful, Doctor, that you're always available. You're always committed to help to the community.
I do it with pleasure.
Thank you. And we feel it. So thank you so much. Dear friends, I want to ask you, if possible, open your camera so we can see you. Because, sometimes to speak to black squares is more difficult. So we'd appreciate this. Want to see your smiles. I want to remind you, it's a live event. It's mean you can ask your questions. Dr. Yuabova will be happy to answer. So Dr. Yuabova, thank you so much, first of all, for joining us and being with us tonight.
Sure.
Because we might have here people who see you first time. I see Cheryl with us, Cheryl Schwartz. Hi, Cheryl. Good to see you. If you can, please, few words about functional medicine, maybe, and about yourself, and then we'll start our topic.
Sure, absolutely. Hi, everyone. I would like to welcome you, and I'm thanking you. I'm very thankful that you have joined. I'm Dr. Marina Yuabova. I'm doctor of functional medicine and naturopathic medicine. I hold a doctorate degree in family nurse practitioner. I am triple licensed in 3 different states. It's New York, Florida, and Nevada, and I do it with pleasure. I work with patients all over United States. And now I have international patients as well. I'm author of 3 books. 3 books are available on Amazon. Very easy read for anybody who's interested. Just put my name on Amazon and you will see. The first book that I authored was on autoimmune triggers. Second one, The Art of Creating Life, about fertility, what causes infertility. And unfortunately, it becoming such a big problem right now. If 40 years ago, women would get pregnant out of the breath of air, now it's such an effort. It's becoming very difficult. Since 2019, it increased, actually, infertility rate went by 20%. So, and this is crazy numbers, as well as neurodivergency increasing too. And we're going to talk about it. So it's just exponentially growing. And if you don't do something about it, if you don't help our children to develop their nervous system at normal rates, it's not looking so pretty. So I'm a parent, I have children. I'm a grandparent, I have grandchildren. So this is becoming very serious and it's very scary. What kind of population are we going to be having in United States in 2030? So it's, it's not looking great. So we need to do something about it and we need to do it now. This presence, the future is now. We should not be waiting. We should be doing it actively and you should be doing it now. So I practice functional medicine. Firstly, I was trained in Western medicine model. I hold doctorate degree in science, but I'm a family practitioner. So I can work with children, I can work with adults, I can work with people who are retired. There's no limit. And I chose it specifically so I can do absolutely everything and anything. So practicing Western model of medicine, I'm in medicine already 30 years. I've been doing it for a long time in medicine altogether in different capacities. So I've seen all different kind of results and absence of results from that model. Okay, so when there is the protocol, everybody follows the same protocol, but don't forget we are different beings and we have different bodies. And yes, physiologically we are similar, but we're not exactly the same. So if we are using the same model and using it exactly for everybody, the same formula, it doesn't work. So functional medicine, number one, in functional medicine, we're looking at the cause of the problem. So where the cause rooted from, and from addressing the cause, we change everything else. In naturopathic medicine, I combine all 3 different models. If I need to give somebody antibiotic, I give it. If there is no way, no other choice, I give it. I never tell patients, you're never going to get antibiotic from me. If I feel and I believe they need antibiotics so they can recover faster, I give it. I do not exclude Western model. The difference is I combine all 3. So functional medicine, naturopathic medicine, and Western, if it needs to be. Of course, it's always a last resort. If I need to, I will. If I don't need, I will not do. So this is a main difference. Functional and naturopathic medicine, it's holistic medicine models where there is no separation of body parts. So where there is a brain, there is a gut, there is a bladder, there is bones and everything. So if you really need to find a provider, you want to find somebody who specifically caters care to you. It's not you going to gastroenterologist separately, you're going to a urologist separately. You need to understand when your body is divided in different systems and person only specialist understands one system, one. They don't understand how your body works because everything is connected. In order to improve function of your brain, everything in the body has to be improved. You cannot treat here without addressing everything else. It is very, very, very important. And that's why specialized medicine, yes, there is place for that, but custom medicine, medicine to your physiology, to exactly what you need. This is what you need to look for. And for these children who are neurodivergent, this is a key because otherwise they don't improve. And that's why we're airing this today. I would like to explain what we're dealing with, explain how it could be done, and you definitely have to have personalized approach to every individual whose lives we need to change. In this instant, it's not one person, it's entire family, it's whole unit. Don't forget, when child is not feeling well and child is not doing great, whole family gets involved, and dynamic of entire family will change. Think about it. You have one child that's not well. Your personal life will change. Your relationship with your partner, your husband, will change. Your ability to go to work will change. Don't forget, children on spectrum, if they're really affected, they really don't grow old. So what are you going to do? If you do not place them in specialized program, they're always with you. It's very hard. What kind of life would that be? Wouldn't it be better if you can adjust whatever's around them, help them develop better so they can develop and their nervous system develops better so they can grow older, and develop and be more independent so you can have your life and they can enjoy their life. I think it's a big difference. So addressing that can change the life of entire family, life of one, a child. So I would like to take this opportunity to start. So you can...
I just want to remind our listeners and viewers, if you have any questions to the doctor, you can meanwhile write it in the chat. And after doctor will finish the presentation, we'll have a time for Q&A.
Let's start. I don't want to bore you any longer. I would like to present all this beautiful information. By the way, when I designed this slide, the slides were designed to be very friendly for even eyes of a child. It's very colorful. It's very bubbly. Hopefully you'll enjoy it. I present information in easy terms and easy words usually in 5th grade level. That's how we've been taught in the graduate program to present information so anybody can understand in any kind of educational level and background. So if you have any kind of questions, please reserve them to the end. I'll answer all your questions if we have time. So why are we doing this today? Firstly, I would like to explain to you how body works, how we can change the life of entire family by addressing a child. And of course, this program is not for children. This program is for their parents. We have these children on the program that work with us. I have a team of people that help me. I cannot do it by myself. And of course, the most important team members of this team are the parents, because children live with the parent. They don't live with me. In order to even understand their extent of the physiological problem, I need to involve parent to compile this information. Let me explain to you and let's go into detail of what is neurodivergency. What is that? Is it good? Is it bad? Or is it ugly? It's not good, not bad, not ugly. It is just different. So neurological system for these individuals works different than from what we are used to, right? We all have understanding of norm and we have an understanding of abnorm. They're not abnormal. They are just different. The way their communication system in the brain works differently for a very specific reason. And we're going to address this. So neurodiversity covers a very big spectrum of all different symptomatic condition. The problems, though, is all the same. What causes it? So dyslexia, ADD, ADHD, Tourette syndrome, anxiety, OCD, and children that are on spectrum all go into this beautiful picture and big umbrella of neurodiverse children. Let's talk a little bit about autistic spectrum. What does it mean? If somebody says, oh, their child is autistic, what does this mean? Or this child is on spectrum. Firstly, the spectrum itself is very wide. It's not like this. It's very wide and very big. And it's not really so linear. These children are absolutely not the same. They're all very different. Some parts of their neurological system is very well developed, and some parts of their system is lacking behind. And everyone is very different. Some children absolutely brilliant, where they are lacking a social interaction, and this relationship with parents, with friends, are almost non-existent. So how can we, and is it even possible to help them? By the way, for those who don't know what's Tourette syndrome, people ask me a lot of times, and what that is, to explain it. Yes, today I have made a post on a TikTok, and I posted a video of this beautiful girl that she has active Tourette's. So she's saying something, and she makes sounds, and then she curses at the same time, and she blinks, and then she ticks. Of course, she's not doing it because she wants to. It's just because she cannot control it. This is something. Her synapses in her brains are overshouting. It's a lot of extra signaling. It's like small seizures all the time. And this is what's happening because it's involved all parts of her body. The brain is our mainframe of the computer. So if brain gets involved, everything will follow. I'm explaining it to you so you understand the extent of it and what gets involved. In reality, now 1 in 7 children are neurodiverse. So every 7th child now has something. And this is to those children who have been diagnosed. What about those children who never been diagnosed and never went to the doctor to get diagnosed? Think about it. Of course, if we'll take everybody and we'll take them all through the testing, we will see that it's not 1 in 7, but maybe 1 in every 4th child are neurodiverse now. Let's look at this statistic. This is a beautiful picture. I created it. And to me, it was an eye-opener because I see this. So I was born in 1972. In 1970, we had here in the United States 1 child and 10,000 that was autistic on spectrum, 1 in 10,000. Now we have 1 in 36 children that's autistic spectrum. Do you see this? So when I went to school, I remember we had children with developmental delay, but for entire school, few thousand children, we only had maybe 1 or 2. We did not have specific classes. We did not have special schools. We didn't have that. We didn't have these children. Now there's specialized schools, specialized programs, specialized classes just for these children. So the increase is ridiculous, 317%. Do you see this? So think what's going to happen in a few years. Now I have this beautiful slide for you. So if everything increases the same rate, which COVID itself, everything that COVID brought, that added additional 20%. So now everything moving even faster. So everything, if it continues at the same rate, by 2032, every 2nd child will be on autistic spectrum. I'm not talking about neurodiversity. I'm talking autism. You see the difference? It's severe neurological issues. A lot of times these children are not even verbal. Think about it. Isn't it amazing what is happening with our population in the United States? It's not just United States. Korea is even worse. Because I did research, I looked at all of this, like, wow, this is just amazing to look at it. So we know that children on autistic spectrum, they don't derive from your socioeconomic status. It doesn't mean your parents are poor, they're not working, there is nothing to eat. Absolutely not. They go exactly similar throughout all socioeconomic groups and ethnic groups. There is no division and replication there. There is no difference. Children on autistic spectrum, boys are 4 times more than girls get affected. More boys, but it doesn't mean that girls don't. Girls do not get diagnosed. Of course, there are girls there too. About 20% of all children aged from 3 to 17 were diagnosed with developmental and learning disability reported by parents. But what if parents never reported it? What if parents never came to pediatrician and never complained to the teacher that something is up with their child and child is not doing so well? Think about it, right? You're only talking about who are diagnosed. Okay, let me move that so I can see. So what really affects neurological development of a child? What goes in effect? Number one, it's always prenatal development. So maternal nutritional deficiency. I do different things in my practice. And once you understand physiology, it really doesn't matter who you're working with because the physiology is physiology and it has to be specific to this individual, no matter what you're doing. So when I'm working with the women, either helping them to conceive or those now people coming, they already pregnant and they have previous miscarriages and they want me to help them maintain the pregnancy if it's possible. Of course, I work with them. Would be better if we would start working before they get pregnant. But it's better to prepare yourself before you get pregnant. Let me explain to you what happens. When woman hits childbearing age, let's say in the United States, the average woman that gets pregnant and has, gives birth to babies, let's say she's 27 years old. I'm not saying 35. I'm saying 27. So at 27 years of age, this is full-grown adult that already has some sort of chemical toxicities in the system because of life, because its environment is just so toxic. There are certain heavy metals, there are certain molds, and so on. Because as we progress with life, if we don't know how to take care of our body, we just regress in all of that. We accumulate because we lose this ability to detoxify. So what happens with this woman of 27 years of age when she's pregnant? I know how physiology works and changes that we go through when we're pregnant, when we carry a child. All these differences and flip-flops of the hormones causes us to lose bone when we're pregnant. That's what happens. But in this women of that childbearing age, all toxicity metals are already accumulated in a bone structure. It's already in a bone. So think, if she's losing bone mass, where are these toxins are going? These toxins are going into the bones of the fetus because it works like a magnet. So when this child is born, this child is already toxic. And what reacts to these toxins? The nervous system reacts. So always better to prepare to soft detoxification, prepare the body, see if this woman who wants to bear a child, missing nutrients, deliver everything to her, feed her body so she can have a healthy offspring. I tell my patients I always bring nature into effect and explain how nature works. I always give example of an apple tree or whichever tree, it doesn't matter. So if you are from New York, we have lots of cherry blossom trees. Spring soon and you're going to see lots of cherry blossoms. It's beautiful. So a lots of times in spring, you see a lots of flowers of cherry blossoms. They're blooming all the time. But there's some trees that early in that period drop the flowers. Do you know what it means? The tree cannot manage the flowers for certain reason, cannot manage the fruit of it because there is no energy to share. There is no energy. So if it is a woman and she was not prepared and she had something she never been addressed, she either predisposed to miscarriages, premature birth, complications during pregnancy, and issues with neurological damage to the child. That's why when I saw this, when I looked at this, these numbers is disturbing. We need to be very careful and we need to be prepared. Everybody should prepare. I'm not saying it's just a woman's job. You want to have a healthy child, the husband should do the same thing. Please prepare your body so you have healthy offsprings, so your life is beautiful and you're having lots of fun. So you don't have to be constantly in doctor's office. So you don't have to be stressed about if your child going to do well, if your child going to be able to attend school, if your child needs special care. When people are young, they don't think about it, but we are wiser. we are older, we have to advise them. It is very important. So premature birth also does not affect well neurological development of a child. The best place for a child, for the fetus to develop, it's in utero. It's in uterine cavity of a mom. This is the best place where a child should be developing a neurological system, not outside. Don't forget, no matter what kind of hospital you go to, no matter what kind of nursery they have, a NICU, intensive ICU for babies, neonatal ICU, nothing will replace the womb. You used to tell our patients all the time, the healthy uterus will do the job so much better than any kind of doctor will do outside. So if we have a patient, we want to make sure that they're pregnant for full term, so baby has chance to develop. If baby is formula fed, of course, it's a big difference. Children that are breastfed do so much better, and their neurological development is so much better than children that are formula fed. Don't forget, don't give birth to calves. We are human species, and our children should be having mother's milk, human milk. Even if we have no choice, the best version would be goat's milk, if this child can tolerate it. Again, Similac and all of these formulas that's made for mass consumption, don't forget that's not made for your child. When you're breastfeeding your child, your body makes formula for this child, milk for this child, that will match his developmental stage. And how our brain works as women, every time when child changes stage of development and growth, the formula of milk will change. And that is amazing. This is what we do. But Similac and formulas that sold never do that. Yes, there's different stages now that they sell. There's Olay, different formulas from Germany, I believe, if I'm not mistaken. There is step 1, step 2, step 3. They break it down at different ages. But America doesn't do that, unfortunately. We don't have that specialty. It is so sad. Nutrition, ability to absorb nutrients. So if mom, when she's pregnant or before she's pregnant, has digestive issues, what does it mean? She has digestive issues. Now she's pregnant. Her fetus is not going to get much because she didn't get much. So she ate some, she wasted some, and very little went to the placenta. That's what baby got. You see, it's very little. It's not really much. Ability to self-regulate. And we know these children who are neurodivergent, they simply don't have ability to self-regulate. When their nervous system goes into system of override, it's simply not stopping. And they just ride them over. And it's very difficult to calm them down, to comfort them. So this is important. Biological gender, as I told you, boys are more than girls 4 times, and that is a lot. Okay, so what greatly impacts neurodiversity? What is that we're talking about? What is happening? So if you Google it, it says it's fully not understood. We know there's genetics and all of the other things. Yes, there is genetics, definitely. And we cannot impact genes. Genes are what are born with. There are also epigenetics. If mom has something, she definitely will going to pass it on to a child. That's called epigenetics. If, for example, I'll give you a very simple example. If this lovely woman, young woman, for example, had egg allergies and she's pregnant, most of possibility that the child that she's going to have will have egg allergy as well. That's called epigenetics. It's what we pass to our offspring. So less we have, less we pass. So it's important to be healthy before you have a child. It's as simple as that. People, when they call me, they say, well, and I explain it to them, and they want to have another child. And I'm saying, you know what, you have medical issues we need to address. And they say, well, but I kind of had a child 5 years ago, and the child is kind of okay. We know this child is already on spectrum. How is that okay? How is kind of okay? When are we okay to have kind of okay? We want to strive to have healthy children, so these children can have good quality of life, so we can have good quality of life as parents too. So we need to take that seriously. So for children who are neurodiverse, what goes in effect? Yes, genetics go into place. We cannot cancel genetics. This is what we bring our children into this world with. But what we can change environmental factors and environmental toxicity. And by the way, when we work with children properly, the genes, they flip over and they change. And that happens. We see it with MTHFR gene mutation. We see that. It takes a long time to fix, but it's fixable. It happens a lot of times, and we see this, but it's a lot of work. So we cannot change genes, but we can change around. We can change environmental factors. We can deliver more nutrients to the brain. We can deliver better food for children so they can continuously develop and so they can have this beautiful life. In order to treat anybody, very precise testing is very important. And test that I chose for these children, something that really doesn't stress them. It's not a blood test. It's not a urine test. It's a genetic test. It's a buccal swab. So it's a Q-tip that goes in a cheek. We take the mucosa from the buccal swab and we send it to the laboratory. Unfortunately, this is not available in New York, but you can receive your kit. You do the swab, you put it in a packet, you drive to Connecticut, drop it off, and it will go to the lab and they'll process it. If you drop it in New York, it goes to garbage. Okay, it has to be dropped in state of Connecticut. If I choose to perform second test, it's going to be doctor's data. So this test I would do, if I choose to do it, it would be a urine test, and I would like to see if this child is missing some kind of nutrients. If I decide I need blood test, I do everything to avoid blood testing because children are traumatized and I don't want to traumatize children. Who wants to do that? Nobody wants. But if we need to understand what is a deficit, then we're going to do special nutrient testing. When we do genetic testing through intellect's DNA, we look at fragments of DNA, the fragments. So this done once in a lifetime. We don't do it more than once. We need to understand what this child was born with so we can understand the deficits and what do we need to change to help this child in neurodevelopment, which is very, very, very important. That's the goal of entire program. So in order to have good results, we address system as a whole, everything. When we address system as a whole, everything changes and kids are just blooming and it's beautiful. Detoxification is a main part of this program. Everything is important, but you have to detoxify. So again, when we do this DNA testing, we will see if they can methylate or methylation is affected. If methylation is affected, a specific process in the system goes through the liver. If there is a methyl donor or not, these are medical terms, and we're not going to go in that. We will give specific nutrients to help this self-detoxification process. Children are not able to detoxify. If they're not able to detoxify, and organs that are responsible for detoxifications are kidney and liver, also bowel, also skin, like all of these organs of detox. But if this child was born and mom passed on heavy metals to this child, this is what happens. Heavy metal toxicity, when it travels through lymphatic system and through circulatory system, it goes from liver, kidney, and then goes in the brain, messes up the brain, and then comes back out through the kidneys. Okay, that's a loop. That's how it works. So if we know this child does not detox by him or herself, we can give special nutrients to help in detox process. So whatever is in the system, it could be already binded to, elevated from tissues, binded to, and excreted. If it is heavy metals and I use my detoxification, I want to make sure I use something that binds it and excrete it through the bowel, not through kidneys, because I want to preserve function of the kidneys. That's very important. So toxins such as heavy metals, as I said, mold, and definitely dietary factors. So let me explain dietary factors for you. Last time when we aired it in Russian, women started asking funny questions. They have funny questions for me. Everybody wants to feed their children cereal, give rice cakes. There is no food. Why can't we give children normal food? Food that's actually nutritiously delicious. The food that we ate when we grew up, real food, a good quality, something that your child can digest. It is very important to deliver nutrition properly, and best if you trust the one who grows the produce, if it is organic, if you trust them, because nobody honestly controls it. And you have to find a great company that you trust that will provide produce that is grown well in clean soil. That is very important. Less toxins will get into the system, easier will be for system to repair and recover. It is very important, and children will be developing much better. In the process, we have to understand what's missing. When we see there are missing nutrients, we're going to have to replace. We're going to have to find a way how to do this. A lot of times for these children, I use a lot of drops because they're also picky eaters and they don't want to eat and they have textural issues. We know that this is not new. These children are very, very complex, very difficult. And if child is neurodivergent, there's always digestive issues, always something. They're either constipated or they have constipation diarrhea, or it's constipation diarrhea and vomiting, all of those, and constant burping. And kids are so picky, they simply don't want to eat. And poor parents don't know how to feed them because these children cannot digest anything. So when I work with these families, we find something that is easy to deliver to a child so child can utilize the nutrition. This is very important. Why we do this? Because you want the body, the system, to start self-regulating. Neurotransmission is very important. And when I'm on air here and I'm explaining what's neurotransmission, it's a communication system between the brain cells plus the system where brain communicates with the body. So we have two-way communication system, cell to cell plus nerve. And nerve, we call it vagal nerve, that communicates from the brain all the way to pelvic bone. So it goes from here and ends in the stomach. So it's very interesting system. Don't forget, we are very complex individuals. We are created by Creator, and definitely nobody can do this job better than Creator himself, really. We are the best of the best. Hopefully can function at the best. That would be great. But we have to work hard now to remain well, because it's no longer easy. It's in order to be well, you have to put work to it. So again, neurotransmission balancing to help this child to control their emotion. So people who are neurodivergent, there is no control. Like these children, these people who have Tourette syndrome, they curse. They don't want to say. There is no control. They cannot control it. Children who are on autistic spectrum, you want to hug them, they kick you. They cannot control it. Their brain is constantly misfiring different signaling. And it's not fun. It's very stressful. So how can we help them? We definitely can, but we cannot do this without parents' involvement. That is a must. Parents have to be in a loop, and we can do this together. So targeted intervention is very, very important. Again, when we do the testing, the dietary modification is very specific to this specific child, anybody or individual, because we have neurodivergent adults too. We have adults with dyslexia. We have adults who are ADD and ADHD. And I have young adults in my program now, and lots of men really who have ADHD. And when we work together, they have specific regimens specifically designed for them. Nobody in my program has exactly the same protocol. Nobody. Everybody is different, and that's why it's catered to everybody's specific need. If it is dietary change, I provide a list with nutrients, with vegetables, proteins, carbohydrates, grains that they can include in their diet. And every 6 weeks, we change it because system gets sensitive to what you're eating. If you're eating the same thing all the time, even if it's great for you, it's going to cause inflammation. We want to avoid inflammation. So this is very specific. In order to succeed on program like that, we have to constantly monitor. That's why in our program, we have a coaching system. We have team of professionals who are trained to provide coaching. Of course, they speak to parents, and then they report their findings to me. If we need to make any kind of adjustments to the program, to protocol, to supplementations, we do it. So these children continuously repair and detoxify. So it is a long journey, guys. If somebody finds themselves in this situation and your child is suffering, whole family is suffering, honestly, please do not lose hope. We are here, we do this work. Unfortunately, United States is so behind, and people that do this work is such a limited amount of people. It's so sad. Not a lot of people do this kind of work. It's very sad. I would like to share with you, I played it last time. I would like to share with you this testimonial of my patient. He's a parent of a child who was born with my help. And I was very proud to be a part of this journey. Life is life, and things do happen. While the child was growing, they moved a couple of times. Other things happen, the things we cannot change. And then they contacted me because they needed my help. And I offered it to help them. We worked for about altogether probably 5-6 months now. And they were kind enough to share their experience with us and with you, so you can understand what kind of changes are possible. Please watch that video.
Charlie's health condition before working with Dr. Yuabova was a little slowed down, I guess, to say the least. She wasn't really meeting her milestones the way she was supposed to. As any parent, you love your child unconditionally, and you only want what's best for them. What motivated me to reach out to Dr. Yuabova the most was used her in the past. There was an issue with us, a lot of miscarriages, my wife and I, and Dr. Yuabova was able to give us a plan, for about 6 months. Obviously, an amazing outcome. We have 2 children now. The hopes I had with working with Dr. Yuabova was just simply seeing progress with Charlie and see her really just strive. The things we did to help Charlie basically was just following the strict guidelines that she gave us with the supplements and everything, doing a full detox of the heavy metals. You could see an immediate change in her physical health. Simple commands like, Charlie, bring me the remote, or Charlie, come give me a hug. Walking up and saying, Dad, help. The biggest unexpected change, I would say, is how loving and caring she's become towards her brother. Her social skills have definitely evolved. She's always been a leader, to say the least, but at least now she understands sharing a little better and connecting with other children and playing together. And Charlie's just really striving. She's meeting all her goals. She's, starting to count. Everything that she should be doing is just, she is doing. I feel in my heart of hearts that Charlie herself sees such a huge difference that she comes up to us asking for it. Little things like that, just absolutely amazing. It affected our family life in a very positive way. Dr. Yuabova does everything with love, everything with her heart. The plan that she sets up, anyone can follow. It's very simple. Just listen, honestly, and you see the results. There's no other way to put it. She's never steered us in the wrong direction. Dr. Yuabova is part of our family because she was a big part of creating our family. Like I always say, I'm not the kind of guy that even believes in half of this stuff. Like I'm a seer to believer. You can see it and believe it.
Okay, guys, I am proud to be taking a part in this beautiful family's journey. It was my pleasure. I know the family. I know the mom and dad and now 2 children, which is absolutely beautiful. And I'm very happy I was able to help them, because if it would not been changed, if nobody would have been able to help them, it would have not been so much fun. Having a child that's not doing well is very, very stressful. So, ladies and gentlemen, this is our phone number. We are here to help you. I will be opening the panel for discussion. Please ask your questions. We have very specific process. If you call, I just would like to let you know, if you call, it will be my assistant who will be taking your information down, and then a specifically trained person will reach out to you and take you through the process before I will be able to speak to you. So we do testing first, and when results come back, because we don't want to waste your time and your funds, we want to do it differently. We want to do what's cost effective to you guys. Children always first. Like parents, whatever we cannot do for ourselves, we do it for our children because we are parents. This is our job. So we changed the way we're doing it. We changed the model a little bit to make it more feasible for you guys. So when results come back, this is the time for me to discuss a program. Okay, not in the beginning. Everything else my assistants will do, and that is their main job. So I'm ready for questions. For those of you who have questions to ask, please.
Yes, doctor. First of all, I want to say thank you so much for incredible presentation. Thank you very much. We have already several questions, so I will start to ask the questions. Thank you again. So I want to start from a question. A person asks, we live in New York. How it's possible for us we have an autistic child, he's 7 years old. How it's possible to start a treatment, if you can explain a little bit.
It is actually very easy. You don't have to bring your child to me. You don't have to fly anywhere. You don't have to stress your child at all. As I said, we do telehealth, and it is a great platform to help people out of state or out of country. So we are unlimited. Who can we help? We're absolutely open to those people who are serious and would like to help their children in no matter what. If you're somebody who's very reluctant, I'm not going to do this, I'm not going to do this, it's not for you. I just want to make sure, like I'm telling you now, you want to change your child's life, you have to be in a loop, or don't do it.
100%.
Cutting corners won't work. You're in New York, you're in Mars. We can do it. Not a problem.
This is amazing. And another person asking, my child has anxiety. Could you help? If you can please speak about.
Definitely. So children with anxiousness, we have to do very specific testing. The testing is a little bit different. So if somebody is anxious, we want to understand if a thyroid is working or not. When thyroid is not working, we need to tweak it so it works properly, because hypo and hyperthyroidism gives, both of those things give anxiety. Plus, neurodiversity is neurodivergent by itself. Just because neural system is not functioning, that also causes anxiety. So it goes in different effect. Always pay attention if your child has any issues with digestion. It's always whatever here and here. Stomach and brain, you cannot divide. It's always here and here. Either constipation, diarrhea, or itchy, like when the anus get itchy, all of that, plus inability to sleep at night. So those kids that are anxious, they can sleep as well. Very disturbed. So we're going to have to do some digging to understand what's bothering this child. Definitely not proper neurotransmission, too much firing, and this is anxiety. Too much firing, too much signaling. They have to calm it down, and they calm down. They get very comfortable. They have peace finally.
Thank you very much. Gulnara writes us a question. If you diagnose pandas.
Oh, this is interesting.
If a child is diagnosed with pandas, what the treatment is done?
Oh, okay. So pandas, this is very interesting. And actually,
you can explain also for everybody.
Definitely. So pandas is a condition. They call it pats and pandas, by the way, that they make fun of it, but it's not funny. So this is a condition usually arises when child has strep infection or something like strep. So when child, again, toxicity, you see, strep infection, it's a bacteria. When child is not able to detoxify that, it causes toxicity of the brain. And then these children have all different neurological signs and symptoms. They a lot of times uncontrollable. Is what I was telling you. You want to hug them, they come and they kick you. That's what they do. It's non-control. So number one, it depends when that was and if bacteria is still active. If bacteria is still active, you have to put them on antibiotic. Because if strep is there or whatever was causing it still there, that has to be treated, number one. By the way, I want to tell you, I have very interesting cases of post-COVID. And it's adults and children. Kids get symptoms like pandas, neurological, and I treat them like I treat COVID patients first. As like, this is long-standing COVID. It's the same like strep throat, it's the same. We treat that first. That you have to deal with bacteria because this is now, it's a main toxin. And then we calm everything down. You need to understand, more you wait, more time for treatment is necessary. It's going to take much longer to fix, as if you would address it much sooner. And again, neurological development of the child, they have to catch up. Every time they miss a month, they need extra month when they're already developing to catch up to development.
Understood. Thank you so much, doctor, about this. Another question, do ASD kids ever have any negative reactions to the treatment? And what age can you start helping ASD children?
I will tell you, the population itself is very challenging. I'm very honest with you because kids are kids. And I'm not doing it with kids, I'm doing it with adults. I teach you how to do it, you do it with your kids. There is no limitation in age. Sooner you start, better you will see results. Like this family, Nick, who
Yes.
video recorded testimonial, when they came to me, when they called me, and when they asked me to help them, Charlie was only 2 years and 6 months old. So she was very young. She was born absolutely healthy. I know I know this girl was healthy and she was developing fine until something shifted, and they know what happened. I'm not going to say it because it's their life. He didn't vocalize it. I'm not going to say it. And then everything changed. It took them 3 months to realize something is changing negatively. And then they asked, I believe, physical therapists to come to the house to evaluate the child. And this physical therapist said, your child is autistic. And they simply just broke them. So there is no limit in age. Faster you start, faster you'll see results. There are no side effects. Kids are difficult. You're going to have to find a way to deal with your own child. It is very specific diet, specifically catered to your child's needs. So you're going to have to alter, your dynamic in the family to cater to needs of this child so you can help them do better. If you do not prioritize that, it will not be successful. I work for results. My patients know I'm so results driven. I want these beautiful results because I want to be proud of work I do. If I don't see how it goes, I simply discharge my patients because I know you're not putting your work in. If I'm guiding you and I'm leading you, you need to follow because this is why you come. If you don't want to follow, don't come, don't do it.
100%. Doctor, I see the same person writes again, any negative reactions that you saw with your children?
No, there is no negative reactions. These kids are very picky and very difficult. They're already difficult from get-go.
100%. Thank you so much, doctor. By the way, there's another interesting question. How valid is the diet of gluten-free that some have tried? If you can't comment on this a little bit.
Valid. Don't forget, kids who are neurodivergent, very sensitive to gluten and dairy. Some people say, well, there's a proof and blah, blah, blah. I will tell you how easy to do this, guys. Very easy. Get rid of gluten and dairy for 6 weeks. See how your children do, and then just give it. And then you will see how fast they're going to regress. There. Amazing. But it's not just gluten and dairy. It is much more than that. It is so much more than that. So I do not know why we as parents holding into this gluten and dairy. We have so much food. Food is everywhere. It's America. You're not starving.
100%. We have many questions. I continue. Thank you so much, doctor, for your incredible answers. My son is 2 years and 6 months old. He had some issues. He started to walking only at 15 months, still nonverbal and very picky eater. Can you elaborate, please?
Absolutely. So this is typical. See, so this child is already in tail end of all the norms. We know that children are supposed to walk at 1 year of age. Okay, you're going to say year and 2 months. Well, he is much later than that. He's showing all signs and symptoms. He's nonverbal. They should be verbal at that age. They should be saying at least 7 words. He's not saying anything. And he's a picky eater. So this is a combination of things that we pick on in the beginning. So if any of you see your children do this, you should know. Almost nonverbal or nonverbal, I understand that boys develop speech later. But at that age, they should be saying stuff. They should be speaking. So sooner you start, faster you see results, faster this child will catch up in development.
100%. Another person, my daughter, she's 5 years old. She had vaccinations and she stopped talking for a week. Now she's okay. What do you think happened?
Well, this is very interesting topic,
I
and
know
I
it's a
will
tricky
definitely
question.
explain that. So, there are children that get vaccination and absolutely nothing happens to them. Nothing at all. There are some children that get vaccinated and something happens to them. They call that vaccine injury. So what makes a difference? Why some children are okay and some children are not? It all has to do with ability to detoxify. Don't forget, when we give vaccine to children, it's not vitamin B12 or vitamin B6, right? It's a toxin that's diluted, that's given very small form. So how we are supposed to make this immune system work so we, build this immunity, we're supposed to react to what was injected. So we build up immune response. And if this infection comes around, the body knows what it is and knows what to do with it. But for these specific children, because they cannot detoxify, it becomes overly burdenful to the system and causes toxicity of the nervous system. And one of the side effects of that, some stop talking, stop walking, some stop talking. It's all for different ones. So they're lucky enough that she was able to become verbal again. She speaks now, right?
Yes.
Exactly. So it's a hiccup, and then her system caught up. They're lucky. Even though if they saw a hiccup, there is definitely something there because it was signal that her brain became toxic for a while. So I would highly recommend definitely put her through some kind of program that will help her detoxify her system so she can develop without any neurodivergent issues in the future.
100%. Thank you so much, doctor. It's a very important information. Okay, Larissa writes, do you accept adults to the program? And what age?
Yes, no limit. Guys, there is no limit. I have women that 74, 76, I have people in all different ages. Only those who care for themselves, please, who
I
really
want to add,
are changing their life.
I want to add that Dr. Yuabova, for many, many years, healing people from the most difficult situations. And when we had our Zooms in Russian, many people was asking, doctor, why not treating children? And actually, the whole this program that created came from people who was on Zoom with children and was asking, doctor, help our children. Doctor says, no, I treat only adults. And for many years, doctor was treating only adults. And this is an incredible program that the doctor is created specially to help kids. So obviously adults is no limitations. Any general advice on how to support a healthy, normal pregnancy?
Definitely. We need to understand what's the problem there. What's deficit? What's not working? If the adrenals working properly, if thyroid gland works properly, if there's enough nutrients being delivered, what size placenta is placenta working properly? Like in order to guarantee healthy pregnancy, from get-go, you have to have a healthy woman. It's better to do it before they're pregnant than afterwards. When they are pregnant, a lot of things we cannot do. For example, we cannot detoxify. You can't do that when a woman is pregnant because don't forget, the fetus does not belong to a woman. It doesn't belong to, it belongs to itself. It's its own being. And if you push it too hard, it's not good. So please, if anybody's serious, do it before. If you're already pregnant, I have specific program. It's called Mommy and Me. This is a program I have. I have different programs for different stages of life of people. So in program Mommy and Me, we support pregnant patients throughout all 3 different stages of pregnancy, 3 different trimesters, 3 first months, 3 additional months, and 3 last months. There is also educational program. It's very specific and geared to this person's need. If she's missing nutrition is delivered. If she It's a little bit toxic. We cannot touch it. She's pregnant. So we avoid it. So she's not reacting. So we do it everything very, very carefully. Everything's done in specific time, and time should be right. So yes, we do have program answering to your question.
Thank you very much. By the way, another person asks very similar, I would say, question that they're preparing actually now for pregnancy, but they have an issue with the thyroid that you actually was speaking today about.
Okay, guys, again, listen, I will tell you something very seriously. Please make sure your thyroid is optimal before you get pregnant. Number one, if your thyroid is not optimal, it's very difficult to conceive because there is no implantation and there is no ovulation. Number two, I do not even know how to call it, lucky, not lucky. If you got pregnant and you have problem with thyroid, don't forget the fetus is dependent on your thyroid gland in 75% cases. Yes, for thyroid. So the fetus is dependent on the function of thyroid gland of the mother. So if mother's thyroid gland is not functioning, neurological system of the baby will not be developing. So we call it cretinism. So it is very important. We know that there is developmental delay and developmental disability. So every third woman that comes to me has thyroid issue. And they don't even know it because they go, they test, everything is fine. They have clinical symptoms. Their blood test is subclinical abnormal, meaning somewhat normal. It's like tail end of normalcy. We don't do this. In functional medicine, they have optimum ranges. If somebody reports to me that they have symptoms such as brittle nails, swollen face, thin hair, thin skin, they're gaining weight, they're constipated, we always check thyroid gland because these are symptoms that tell us that there's a problem with thyroid gland. This must be addressed before pregnancy. It is very, very serious. Very serious. Again, you want a healthy baby, you have to have a healthy mommy. The father too. I'm not excluding the father either. Please, you want to have good family, healthy family, so the entire family unit thrives. Take care of yourself and be smart, be proactive, please. This is important.
Thank you so much, doctor. And the last question for today, we have many, but for today's program, person asks, we're coming back to the program that we started about how to help children with any developmental delays. So right as a person his son is diagnosed as autistic, and he's asking about if you can please explain the process of this program from start to finish. So just
from start to finish.
So thank you so much, doctor.
Absolutely. As I said before, you make a phone call. My assistant will accept a small payment. So there is small slot for you with a coach. It's not overly expensive. It is not. You will speak with the coach and coach will compile all the information that's necessary so we can understand how we can help you. When the coach compiles information, she will already know if you're a good candidate for testing. We don't want to waste my time. I don't want to waste, and I don't want to waste your funding. It is very important. If the trained coach understands that's a good fit for the program, we're going to process that testing. The testing is not cheap. Genetic testing is expensive. You're only going to do it one time in child's lifetime. You don't ever need to repeat that. I need to understand what am I working with. When genetic testing will come, it will be me who will present the results to you with a program. I will present to you all different parts of the gene, and I will explain to you what's not working and how we can address that. Because every time the SNP, we call it SNPs or snippets, they give us information we understand because of a certain deficit or different function of that SNP, what this body can and cannot do. That's how we will adjust it. There is no mistakes. There's no eeny, meeny, miny, mo, maybe will work, maybe will not. It is not. This is science. Okay? I will create a program according to that test. The program includes my treatment plan, dietary modification, and coaching. The program itself for children, minimum 6 months. You have to understand, in order to change life drastically, you have to invest your time. It does not happen overnight. But you heard Nick, his daughter Charlotte, she's absolutely now delabeled. She's no longer on spectrum. She does everything like what she's supposed to do. She runs, she laughs, she talks. You saw the picture. She has perfect eye contact. She looks right at the camera. You saw that. And that child that has been diagnosed autistic, okay, that she was not even talking much. She became a parrot, saying mama, mama all day long, mama, mama, where this lovely girl was actually speaking. And then she became that. So this is how this changes. But as a parent, you need to understand the work is on you. I guide you, you do it. I cannot do it for you. It is your job as a parent to do, not mine. My job as a professional, as a provider, and I do my job with a pride. I do it with love, and I love what I do. So if you would like to be a part of this community, and I'm growing community, it is National Wellness Group. It's Wellness of the Nation. Listen to the name. When we named it, it's like, okay, let's name it. Let's see how far we go. And we are going. So it's Wellness of the Nation. And if you care for your child, which you should, because it is your child, you are welcome into the program.
Thank you so much, doctor, for this information. People ask me about the phone number of doctors. It's 561-781-8888.
It's very easy, guys.
Yes, very easy. And doctor, I want to say again, add for myself, I know Dr. Yuabova for many years. And most important, not that I know Dr. Yuabova, but I saw with my eyes how my community members who had incredibly difficult, doctors told them it's incurable. And doctor helped with pregnancies, with Lyme disease, with children who had development delay, so many cases. So thank you, doctor, for what you're doing for all our community. Thank you for this specific today program. I'm so happy that the first time doing this in English because so many people was asking, and we'll see you, God willing, at the Shabbaton.
I will be there, definitely.
Yes, the 15th International Russian Jewish Shabbaton that we do for 1,200 people in Hilton, Parsippany, New Jersey on March 29. Last year, the doctor was there. It was very for me, it was very difficult to be able to talk to the doctor on the Shabbaton because she was all the time surrounded by people. So we're looking forward to see you at the Shabbaton with your lectures.
Thank you very much. I definitely will be there.
Thank you for the amazing transformation you help to people to do. And, you know, unfortunately, sometimes we wait. And it says there's 4 names by the Satan in the Midrash. Satan, first name is Satan. Second name is Angel of Death. Third name is the evil inclination. But the last name is tomorrow. We postpone things for tomorrow. And this is the name of the Satan. And so many people I know says, why I didn't do it before? So, guys, truly, don't wait for tomorrow. We have opportunity. We have incredible tools to change the life of our children, to change the life of our families, to change our lives. Because when the Baal Shem Tov was asked once, what is hell? The great mystic. We said hell is when you have the image above, is the way how God see you. Your potential, why you came to this world. And then you have the image below, what you're going to do with all these powers. And very often, what we do is a very pale copy of our true potential. And when the soul comes after 120 years, and you see what you could do and what you did, and you cannot fix it in any way, so this shame of the soul, this is hell, the Baal Shem Tov was saying. But what stops us very often from getting our image below to be a little bit closer to the image above is our health. And we must invest in it, and we must help our children to be closer to the image above. So thank you, doctor, again, for this incredible
Thank you very much.
program.
Thank you for having me. It was my pleasure. I come to your programs as to have fun.
But we're having fun for sure. And thank you so much.
Thank you, everyone, for being here. Have a great night. I will disconnect.
Thank you. Thank you so much, doctor. Have a good
Bye.